Coming up on Healthy Minutes with Dr. Mo.
Find out how too much texting could injure your thumb. How did technology increase our risk of acquiring disease? Take a trip back to the world of ancient Chinese medicine. And meet the father of modern genetics. Hello and welcome to Healthy Minutes, the program that talks about your health. I'm your host, Dr. Mo. Now, like many of you out there, I'm an avid user of technology. It is not uncommon to catch me going through my phone, my tablet, or my computer, typing and texting away for work and recreational purposes. Now, the overuse of these devices have made us susceptible to a number of injuries. And today I'm shedding light on one I'm currently experiencing, decurvain tenosynovitis, or the texting thumb. And believe me, it sounds better than it actually feels. To shed more light on the disease, we paid a visit to consultant orthopedic surgeon Dr. Jamal Saleh, who made the diagnosis and explained more.
It's a form of tendinitis. Tendinitis means that the tendons, which are the terminal parts of the muscles that are attached to the bones, they get inflamed. And there are so many causes for the tendons to get inflamed. One of them is decurvain, and decurvain is the name of the Swiss surgeon who described this condition 120 years ago. Basically, it's inflammation of the tendons that move the thumb. So whenever you are using your thumb excessively or putting it in an awkward position and sustaining that position for extended period of time, whether it's minutes or hours, doing the same repetitive movement, then that would trigger the fatigue followed by the inflammation of the tendon. Naturally, our body is all the time is trying to heal and mend all these minor elements in the body. For example, if there is a little inflammation, some strain, some sprain, the body is able to manage it with its healing mechanisms. What happens is that if you don't allow the tissue, which is here in this case the tendon, to heal spontaneously, and you keep stressing it by the repetitive movements and the repetitive postures and stresses, then your body would not have the enough time to heal this tissue. So it gets inflamed. What people complain of then is when they use the phone, the PC, the keyboard, writing sometimes, when they are writing on a board for a long time, whether it's technology assisted or not technology assisted, they'll be having some pain in the thumb. And that typically the pain is around the base of the thumb and the wrist region. Decurvain also not only happens because of repetitive stress movements and injuries, it can happen in pregnant women and ladies who are nursing their children when they are at the age of between the time they are born until they are a year or a year and a half. And we know that decurvain is more common in females than males. Now, we don't know why it happens. We know that it is associated with certain, as I said, movements or repetitive stresses, but not necessarily every stressful movement will cause decurvain or the synovitis of the thumb. Pain is usually the main feature. People feel that there is pain whenever they move their wrist. Usually a movement like this, when they make a little fist, they feel pain, sometimes mild, sometimes very severe. Sometimes they feel it like a sharp jab that hits the base of the thumb and the wrist. And sometimes they feel it as just a nagging pain, burning sensation, some hotness in it. Some of the movements are restricted. So these are the hallmarks and the different symptoms that a patient can go to the doctor complaining of. Now, when we see this patient, we take a little history and we ask them if there are some factors that have provoked and started and initiated this or not. Many times you can find a causative factor. Someone is stressing her hands, heavy lifting, bad postures, the telephone texting for extended hours, and so we try to educate them on trying to minimize and reduce the stresses and the bad postures. Something very simple sometimes is if someone is using the keyboard and with their wrist being extended, being cocked up like that, that throws a lot of tension on the wrist tendons and sometimes the carpal tunnel as well. And just asking a patient to put a wrist pad, for the keyboard, and holding the wrist like this instead of like this, that can improve the symptoms dramatically. So we take a history, we see what provoked the condition, and then we go over some kind of education to the patient, and sometimes just doing these simple measures, trying to correct postures and so, can relieve the symptoms. Now, the symptoms are more chronic, more acute. Sometimes we need to intervene and give some pain modalities. Now, these range from simple medications, analgesia we call them. Sometimes we apply ice, and we ask the patient to apply ice to reduce the inflammation. An anti-inflammatory gel, the different types of anti-inflammatory gels, and a splint to keep the wrist in a good position, not in the awkward position, helps a lot to alleviate the pain because it will reduce the movement of the wrist. So this helps in about 50% of the patients. Whoever don't respond to this can go to the next step, which is helping them through physiotherapy. So they can apply the ultrasound and the shortwave and the TENS machine and all these modalities to try to reduce the inflammation in the tendons. If that works, then it's good. If it doesn't work, then we move into the third step. And the third step is usually given steroid injections. That helps a lot. The steroid injections are made of a local cortisone that we apply in a very 20 milligrams, let's say, and we inject it around the tendon, the inflamed tendon, not in the tendon substance itself, but around the tendon sheath, and that gives good relief. And many patients just go and have good relief for many months, in fact many years. And they come maybe years later with having the same symptoms coming back again. Now the last resort then, if this keeps coming back after using all these conservative means, is to do surgery, and surgery is a quick relief and an immediate relief. So in surgery we just go and release the tissue that is compressing those tendons, because that tissue, when it gets inflamed, it presses on the tendon and it causes all the symptoms. So when we go surgically and release that tissue, the patients get immediate relief.
You're watching Healthy Minutes with Dr. Mo.
Welcome back. We're still on the topic of technology and the new health risks associated with it. And the texting thumb is just one of them. These gadgets have been linked to an alarmingly increasing rate of a number of other conditions. Let's take a look at the most prominent diseases brought on by modern technology.
A recent study in the US has shown that in 2012, 79% of the US population between the ages of 18 and 44 have their cell phones with them almost all the time, with only 2 hours of their waking day spent without their cell phones in hand. The posture in which we use a smartphone or a tablet with a device situated at a level below our eyes means that we typically lean our head downwards and extend our neck in the forward direction. Research has shown that this posture and downward lean puts strain on our neck of approximately 27 kilograms, the weight of a 7-year-old child. Modern devices have been linked to an increase in stiffness and pain around the neck. It can also lead to shoulder pain and tightness and possibly resulting in painful shoulder muscle spasm. If this goes untreated, it can lead to chronic problems due to early onset of arthritis in the neck. Our eyes were obviously not evolved to be used to stare at a computer screen for extended periods of time. But let's face it, this is our reality today. When working on a computer screen, we blink less and move our eyes less. The eyes become dry and red. Other symptoms could include itching and swollen lids. Symptoms are temporary, but this could lead to permanent changes in vision. Earbuds are headphones that are used with many digital music players. They fit inside the ear and do not cancel out background noise, requiring users to turn up the volume, often to 110 to 120 decibels, loud enough to cause hearing loss after only an hour and 15 minutes. And today, people spend much more time listening to their portable players, exposing themselves to damaging noise for longer periods of time. As a result, young people are developing the type of hearing loss normally seen in much older adults. Although traditionally caused by tennis, as the name suggests, now it is also due to computer use. Tennis elbow occurs because of repetitive movement of the fingers and wrists, resulting in an overload in the muscles attached around the elbow. This leads to inflammation and pain around the elbow, making it difficult to grip and lift objects. This used to be caused by hot water bottles and heating blankets. Now doctors are getting these cases because of laptops, mainly due to prolonged skin exposure to the hot base of the laptop. This causes a mild and transient red rash, which can become permanent with prolonged exposure, increasing the risks of skin cancer. Research has also shown that laptops resting on the thighs could have an impact on reproductive abilities. E-thrombosis is a development of clots in the deep veins of someone who spends long amounts of time in front of a computer without moving. Although only a handful of e-thrombosis cases have been reported, millions of people who spend most of their time in front of a computer are at risk. These clots can be fatal if they migrate to the lungs and cause a pulmonary embolism. Technology has been attributed to a number of psychological disorders, including general anxiety, social anxiety, depression, internet addiction, and narcissism.
Visit our website, healthyminutes.tv, or follow us on Twitter and Instagram @healthyminutes.
This video is a courtesy of the Red Cross. In this video, you will learn how to administer first aid to a person who has just broken their arm. Tell the person not to move their arm and to support it without bending or extending it. Use the victim's upper garment, like t-shirt or sweater, to hold the limb securely in one place. This will prevent the fracture from worsening. You can also secure the limb in one place with the aid of a scarf. Call the emergency services, especially if it's an open fracture. Carefully remove any jewelry in contact with the affected limb. Do not give the victim anything to eat or drink.
You're watching Healthy Minutes with Dr. Mo.
Welcome back. Now let's take a break from modern technology and take a trip back to a couple thousand years ago and a look at the way the Chinese used to practice medicine and deal with these injuries. Traditional Chinese medicine is based on the body's vital energy known as qi and its flow through different channels known as meridians, which branch out to the body's different organs. It focuses on the organ's functions rather than its anatomy and its harmony with the outside world. Chinese medicine involves a wide range of practices ranging from massages, exercise, herbal medicine, cupping, and acupuncture. Let's take a look.
当你发烧的时候，当你感冒的时候，自己的身体会自觉的升温，升温其实就是自己的保护。但是西医的做法就是让这个热量
For chronic problems, they feel they still got the same problem or become worse. That's why in the end they're looking for alternative medicine, and then they got very good benefits.
然后我们这些病人呢，大部分都是一些痛症，
So
还有
mainly
一些就是
our patient
神经方
they
面。
come because they have pain, like neck pain, lower back pain, knee pain. At the same time, most of the patient they are stressed, yeah, and some of them like imbalance of the body.
.针灸跟的中药对于我们来说是，并不是我们中国人的祖先发明的、发现
Acupuncture
的，
has
也不是
long
地球上面的文
history
明，而是
because according to the lip code, so it's more than 5,000 years history. So we have our own book or some like documents
中医说的是有经络人体。
according to the meridian of the acupuncture point, the acupuncture meridian. So that's why he select the different points for the neck problem. Yeah, according to the situations, normally acupuncture we keep for 20 to 30 minutes. Sometimes it can be longer as well.
一般对于我们来说，最常用的就是去除局部经络里面的淤阻在里面的寒、湿跟的
The
毒
fire
性。
cupping
这个效果
is
是
to
非常快
helping
的。
the
先把那个好
unblockage, because usually you know the muscle being blockage, and then we got stiffness or pain or tensions. The fire cupping to increase the blood circulation, to hit up the cup, and then when we shock to the muscle, and then the muscle can be moving the cups. To moving the cups means to open the channel, to open the meridian, and then in order for the toxin to go out.
You're watching Healthy Minutes with Dr. Mo.
Now to our medical wall of fame. It is important to remember medical discoveries and breakthroughs that have managed to change our understanding of medicine. Every show, we will feature one of these great discoveries and look at the stories and people behind them. Let's take a look at what we have in store for you from great discoveries on today's episode.
Gregor Mendel is known as the father of modern genetics. Born Johann Mendel in 1822 in what was Austria and is now the Czech Republic, he excelled at school and became a monk to finish his education. He became known as Gregor when he entered the monastery. The monastery sent him to the university in Vienna, where he got an education in science, math, and botany. He then accepted a teaching position in the monastery at Brno after completing his studies. It was during this period that he began his famous pea plant experiments. He crossbred different types. Before Mendel, people thought you would inherit traits from both your parents in equal proportions. Mendel found that instead there were dominant and recessive traits in all organisms that were passed on statistically according to the mixing of these genes between the two parents. Mendel also discovered the fact that there are a large number of traits that are passed on randomly that are independent of the traits of the two parents. The ability to explain hereditary diseases are all the result of Mendel's research. During his life, though, Mendel's research was widely disregarded. It was only after his death that his work was appreciated. And so today, we remember Gregor Mendel for his work, which laid the foundations of modern genetics and gene therapy.
You're watching Healthy Minutes with Dr. Mo.
That's it for today's show, folks. Technology has indeed made our life easier in many ways, but overdoing it could have negative effects on your health. Visit our website, healthyminutes.tv, or our social media channels. Leave your questions, suggestions, comments. We'd love to hear from you. Until next time, keep safe and stay healthy.